مع دكتور عبد الله قشقري. He's a senior registrar in urology, currently in National Guard Hospital, and he was the former chief resident also in National Guard Hospital. فنسعد باستضافتك اليوم دكتور عبد الله للحديث عن تخصص اليورولوجي. تفضل دكتور.
طيب، السلام عليكم، يعطيكم العافية أول شيء على الملتقى الرائع واللي حيفيد إن شاء الله كثير من المقبلين على التخصصات في المستقبل. طبعا أنا عبد الله قشقري، خلصت اليورولوجي بورد وتخرجت من الحرس بروجرام في جدة. يعني في البداية بس نتكلم عن نتكلم عن اليورولوجي ان جنرال. طبعا اغلب التخصصات الجراحيه تكون 5، فاليورولوجي سيرجري نفس الشيء، هي تكون 5 سنين توتال. في حاجه مختلفه شويه في اليورولوجي اللي هي السنه الاولى. ف during R1 you have to do 9 months of general surgery و 3 months of ICU. ف R1 you don't do any urology rotations or urology exposure. بالنسبة للاختبارات برضو it's similar للother surgical specialties. Every year you have to do an annual promotion exam. طبعا promotion in R1 is general surgery, is not urology. Depending on where your rotation is for general surgery, you have to do the promotion. I think برضو الجنرال surgery they do oral في R1, so you have to do the oral and you have to pass both of them in order to proceed to R2. In R2 you start your urology training. طبعا R2 R3 junior years و 4-5 senior years. في R2 or R3 you can do part 1. وبرضو طبعا during every year you have to do promotion. طبعا دكتور دي قادر يتكلم عن موضوع البارت والبروموشن، احيانا يلغوه او يخلوه، بس بالنسبه لليورولوجي you have to do the promotion every year even if you pass the part. طبعا at the end of the R5 you do the part 2 examination والأوسكي، او زي ما تغير دحين صار oral structured exam. طيب, what are the mandatory and elective rotations during the training? طبعا mandatory rotations mainly you have اللي هي 1 month emergency surgery ويكون during junior years, so either R2 or R3. Elective rotations 2 months in total. So in urology you only have 3 months rotations. One is the emergency medicine during R2 or R3, and then 2 months برضو in R2 or R3. A wide variety صراحة of specialties, radiology, pathology. You can also do plastic or any other subspecialty in urology that may not be covered in your center. Otherwise, all your rotations in urology, you just work in urology during your from R2 to R5. One thing to mention, most of urology programs are joint in a way, يعني شيء شوية modified. R4, in R4 you do your rotations outside of your center during all R4. فبرضو حتى هذا الشيء بيتغير صراحة recently. مثلا in National Guards صار يعني specialized center لحاله، يعني ما له علاقة بالهيئة. ف in R4 you only can do 3 months outside rotation. But generally speaking, in all other centers, in R4 you do rotations outside, mainly to cover subspecialties that are not covered in your center. طيب, what are the advantages? طبعا the first thing is it's a focused surgical specialty on the GU system. So you will mainly be working on the adrenals, kidneys, ureters, bladders, urethra, and the genitals. You rarely, sometimes you need to do يعني surgeries that are related to general surgery. That's why in R1 you have to do 9 months of general surgery in order to occupy yourself with the skills and the knowledge needed as a surgeon in general. طبعا home on call services in most hospitals. What does it mean? Your on calls are basically home on call, generally speaking طبعا. بس هنتكلم عن الشيء هذا برضه in details in the disadvantage part. During your junior years, even seniors, your on calls are home. So you receive the calls from home. If you have to come to the hospital, you will attend to the hospital to do whatever is needed. One more advantage is the variety of surgical techniques and approaches. It's a very good advantage, honestly speaking. So you can do open surgeries, you can do laparoscopic, robotic, which are minimally invasive. There's also the option of microsurgical, especially in infertility cases, and endoscopic. So if you want to treat like bladder tumors or even the prostate. One more advantage is the wide variety of focused fellowship programs. I think all surgical, even medical specialties have a variety of fellowship programs, which is a good opportunity for any specialty to focus on any fellowship in particular. One more is you deal with all kinds of populations. So in urology, you have to deal with young, old, men, women, and also pediatrics. Excellent and swift outcomes for most patients. Yes, so the outcome is fast. You receive a patient with a stone, he's in severe pain, you do a simple procedure, maybe you clear the stone or even just put a stent and he will remember you for life. So the outcomes are very good, not only in stone cases, in almost all cases. The last one is, it could be subjective, like in general, it's a less hectic surgical specialty overall. You don't have that element of stress all the time. There is, of course, but it's not all the time. It's like you have time, you know. During residency, you will always be busy, but at the end of when you are done with your residency, you can choose whatever you want to do, and the timing, you will have time to manage your life, to manage your surgeries, which is, I think, is a very good advantage. طيب, disadvantages, as I said earlier, you can be home on call, but it depends really on your service or your hospital. أغلب المستشفيات, honestly speaking, you're not home on call. You're always in the hospital, taking care of your patients or emergency patients or even intra-op consultations. Few centers that have less load, so they are less busy, so you can actually enjoy the privilege of home on calls. But generally speaking, junior years, most of your on calls, you might be home or you might be in the hospital. But as soon as you reach R4 and R5, you will become a second on call, and you would be staying at home, receiving the calls from your junior. Sometimes you have to go to the hospital yourself to assist with him or even to attend surgeries. One more disadvantage is the lack of subspecialties in many centers. But because we have a lot of subspecialties in urology, not all centers cover them. That's why actually they in R4 they have to rotate outside to cover them. So it's one of the disadvantages. طبعا, it's a surgical specialty, so it's physically demanding and also mentally demanding. You would be surprised. You would think that you are urology when you're doing surgeries, but the amount of knowledge you have to know and understand is very large and vast. It's also one of the disadvantages or one of the things you have to consider when you decide to go for urology. طيب, what is the lifestyle during residency? I would say in all residency programs, you will be busy, it's heavy, it's challenging, because you are a resident مقيم. You should stay in the hospital, you should do your work, you should maximize the benefits of your training program in order to become a good doctor after all. طبعا, in any surgical specialties, you have inpatients, you have clinics, you have surgeries and on calls. So of course it will be busy and heavy. The on calls are a lot because it's a subspecialty. Mainly 5 to 10. يعني it can reach up to 10 because you're mainly home on call. But if it's not applicable, يعني the program and the director, they take this into account. So you will have less, مثلا 7 أو 6 during the month. But as soon as you progress during the residency, your on calls become fewer. يعني in R4, R5, maybe 3 or 4. حتى if you have 6 on calls, you are actually second on call. It's less busy and less stress. طبعا هذه النقطة برضو عرج عليها دكتور عبد القادر. In surgical specialties, you're always you have to always come early, know your patients very well. You start around early because afterwards you have clinics or surgeries booked. You have to come all the time early in order to be able to finish on time, which is usually not the case. طبعا, as I said earlier, I mentioned that there is a lot of reading and surgical skills to master. وزي ما قال دكتور حارثي, you have to always be in the OR, you have to learn from minute one, you have to attend all the time. The more you do, the more you become better at. But in general, it's like in your residency, it's busy, it's heavy, but you decide really if you want to enjoy this or not. طيب. After the residency, after residency, صراحة يعني a lot of doors will be wide open for you, and basically you dictate how you want to يعني deal with your career life. Most centers, يعني the general ones, are busy in terms of services. If you choose مثلا a fellowship that is more general, it will be busy for you. Like in general, basically you decide if you want to do more surgeries, if you want to work in like multiple hospitals, or if you want to stick with whatever you want to do in your original hospital. And we have the good thing is there is always need and demand in, I think, in medical field in general, but in surgical, even in urology. It's a subspecialty, it's still growing, even in major cities, maybe not Riyadh, but other cities, there is a lot of job opportunities and many fellowship programs that you can go after. Right. Available fellowships, plenty, honestly speaking. نبدأ بالendourology. In urology, you mainly deal with stone diseases or stone surgeries, whether in kidney, ureters, or bladders. You will also deal with prostate surgeries. Andrology mainly focuses on men's health, sexual health, and infertility. We have urology, oncology. Oncology, طبعا, you deal with all kinds of genitourinary tumors. And then pediatric urology, female urology, and voiding dysfunction. There is some sort of overlap. Some fellowship programs combine both. But in general, female urology, you deal with female patients that need like stress surgeries or overactive bladder surgeries. Voiding dysfunction, as I said, if someone who has voiding element dysfunction, you can perform surgeries or reconstruction for them. Minimally invasive, like laparoscopic or robotic surgeries, whether you work on benign conditions or oncology conditions. And then reconstruction again. And lastly, renal transplant. Renal transplant is also shared with general surgery. One thing to mention here is most fellowship programs are available in Saudi Arabia, so we have local programs. I think almost all of them, except minimal invasive, and even reconstruction. Hatta this year we have renal transplant fellowship in Jeddah and Riyadh. Female voiding and mainly programs in Riyadh and Sharqiyya. Pediatric also in Riyadh. So most of the fellowship programs either in Riyadh or Sharqiyya. And you can also pursue the fellowship programs, of course, outside. But would you join the same specialty again? Well, for me, yes, 100%. But I think it's very subjective on you and your personality, whatever you like and want to do. But me, I would 100%. Why? It's a surgical specialty, so I work with my hands. I do surgeries. I enjoy doing these things. Second, it's just for me, it's a less hectic, less stress wise specialty. So for me, it hits the jackpot. But what is new in the specialty? All surgical specialties, I think, in general, have developing innovations and technologies. I can share a few examples. Minimal invasive and robotic, so are incorporated in almost all surgeries now, even in urology, which have faster recovery, less expenses on the hospitals. Urology specific is like new technologies like the lasers. We have different type of lasers, and one of the newer ones are very powerful, less damaging to surrounding tissues, so you can use them on stones and strictures, even resection of tumors. One of the new ones now, I think only a couple of people here in Saudi do them, is prostate inoculation using the laser. So you remove all of the prostate with basically zero blood loss, and patient goes home on the same day. In general, prostate is a very bleeding or bloody organ. That's why. I think in general, surgical specialties are always evolving and developing, which is always good as long as it's for the better care of the patient. This concludes my talk. I hope it was helpful or informative.